information conference from number 6 Commonplace. Before I start my statement this afternoon in earnest, let me wish all members of our Muslim community a happy first day of Ramadan. This Ramadan will be different to others, as has Easter and Passover. And I do hope you will all be able to observe the important parts of your rituals, even without the ability to worship together. This afternoon, I want to give you information on the latest statistics we are dealing with on the spread of COVID-19 through our community. I will then talk about the renewal of the general lockdown regulations. Then I'll also talk to you about the first payments now being made under the Beat COVID measures. And then I'll ask Stephen Linares, the Minister for Housing, Youth and Sport, to address you on some aspects of how his ministries have been working on matters during the COVID emergency. So, ladies and gentlemen, today, the total number of tests undertaken so far in Gibraltar for COVID-19 are 2,062. The results pending are 76. The results received are 1,986. We've had 133 identified cases of COVID-19 in Gibraltar. Of these, 129 are recovered and 4 remain active. There are no COVID cases in our hospitals. There have been no COVID deaths in Gibraltar. It will not be lost on you that the number of people presently reported as having been detected as being positive with the virus is very low indeed. We have only 4 infected individuals detected. Our success in keeping that number low may be our greatest challenge in persuading you that the lockdown rules must continue. But as we start to do more random testing, we will likely find many more asymptomatic carriers are present in our community. So please do not think that we have beaten the virus. Do not think it is now safe to go out with impunity. It is not. I want to be blunt, clear, and honest with you. The virus is out in our community, and you would be foolish to relax your attitude to remaining safe indoors because the sun is shining or the numbers of infections detected is low. And also remember that the virus is out in abundance in Spain and in the United Kingdom, from where we will see people access Gibraltar, perhaps subject to some controls in the future. For that reason, as we agreed on Monday, and as I announced with the leader of the opposition, we have overnight renewed the lockdown rules affecting all of our population. The new regulations will take effect from today and have already been passed into law by the Minister for Civil Contingencies, Samantha Sacramento. So please be clear, the lockdown rules continue. The new rules have been passed into effect for another 30 days, but they will be reviewed every Monday. Remember, I have told you that we will not allow these rules to remain in place for one moment longer than is necessary. But neither can they be lifted, in whole or in part, one moment before we're able to confidently lift them. And so on Monday, we will review not just the rule relating to the over 70s, but also the rules relating to the general population that we have renewed today. Remember also that in Gibraltar, our rules have been designed to be more permissive than elsewhere. Here, you have always been able to go out for exercise if you're under 70, and children have always been able to go out at least once each day. That is why we are also designing a bespoke exit strategy for Gibraltar, which we expect to be able to publish very soon. In preparing that strategy, we will be following the recommendations set out by the World Health Organization, and we will have regard also to the advice and strategy being pursued in England, in Scotland, in Germany, and in Spain, as well as in other countries and areas. We are looking at every relevant piece of advice and example to prepare the best bespoke and most effective strategy for Gibraltar. But let us be clear, that strategy is not going to be about returning to normal. because we cannot return to normal for now. It is going to be about living with the virus for now. Social distancing is therefore, unfortunately, here to stay. That will potentially mean temperature testing at entry points to Gibraltar, or entry to businesses being controlled also with temperature access controls, or areas of Gibraltar being controlled by temperature access controls. This may also involve guidance on the use of masks going forward. It will likely involve a very different way of going to the beach this summer. And it will involve people being encouraged to self-identify if they have the symptoms of the virus and to self-isolate without fear of financial loss when they do so. The future may also involve very aggressive testing and even more aggressive contact tracing, and where necessary, the imposition of self-isolation. It may involve new apps deployed on your phones. We're already talking to the United Kingdom Department of Health and Google and Apple about these opportunities via colleagues in the Foreign Office, with whom we've been working closely during the course of this public health emergency. Additionally, we may also bring into use other technologies which we already have in place in Gibraltar, like our GIS system or our NCS systems being brought into play to work together. But if these technologies can be used to help us with the virus, we will be using them in a way that protects your privacy and your data as much as possible. We'll tell you much more about this as these opportunities develop. And I repeat, the foreseeable future will involve social distancing continuing. It will involve businesses returning to a different world. We will give you much more detail on all of this as it develops. But I do think it's important to take a moment, though, as we plan for the future, for us to take stock and reflect on what has happened. The fact is that science has helped us to identify this problem, but it is not yet helping us to solve it. Why are we in lockdown? Because we know the virus kills, but we do not know how to cure patients or immunize patients. And cure or vaccine are further away than we would want them to be. So we have, in effect, had to resort to quite a blunt approach to slow down the virus. We have simply had to get out of its way. We've had to retreat into our homes to avoid catching the virus. To an extent, we have learnt the humbling limits of humanity's abilities. Our scientific knowledge, even our ability to map the human genome, have not yet been enough for mankind to harness a response, cure, or immunity to the virus. That really is worth pausing to reflect on. To an extent, COVID-19 has really put us in our place. So please remember, if you go out, you put yourself at risk. You also put at risk the GHA's ability to deal with other cases. So please only go out if you have to and in keeping with the rules. And that includes those of you who feel the most frustrated, those of you who feel the bravest. You could be dead within 21 days of contracting the virus, whatever your age, especially, however, if you're over 70. And I don't want to lose any of you to coronavirus, whatever your age or your vulnerabilities. So please understand that I fully sympathize with your frustrations, and we will soon be giving you details of how we'll permit exercise for our over 70s and introduce other flexibilities. But for now, we're doing what we have to. Frustrating though it is, and with the consequences we fully appreciate that our rules have for your civil liberties. Of course, as a result, we do not presently have a fully functioning economy. That is why we've had to design our business and employee assistance terms, or our BEAT COVID measures. Today, we're making our first payments in respect of this scheme. We're starting to make payments which will total in the region of £5 million in the next couple of days. These payments relate to the majority of the claims made up to last week. They represent payments to 4,500 employees in our economy. These are employed by 750 employer companies who have claimed on their behalf. Also being paid is a sum close to £310,000 in respect of 355 self-employed persons whose claims have been approved for payment. Another 750 applications have been received and have to be processed and assessed. That could push the total amount paid to the region of £6 million just this month. A fuller statement with more statistical information will be shared with the Leader of the Opposition and the Cabinet, as well as with members of CELAC. Once all applications for the month of April have been fully processed, a full statistical statement will be issued with breakdowns for the general public. I must also tell you that we have received over 1,000 emails on inquiries in respect of the Beat COVID measures. These have all now been replied to by a team made up of John Paul Tha, Patrick Ganessa, Ishbel Armstrong, Carla Malle, Alison Cruz, Gerard Douma and his team at the Ministry of Business, John Lester and his team at the Tax Office, Debbie Garcia and her team at the Employment Office, and Charles Santos and his team at the Treasury. This has been a magnificent effort led by Albert Mena as Financial Secretary. They have become the midwives of this aspect of this project to keep our economy alive and jobs and working people protected and with the income that they need to put food on the table at this difficult time. A large portion of all employees in our economy are therefore now on the government's books for this month. But our spending now is to stave off social and economic collapse in Gibraltar. We will achieve that. And I think we've made history here, especially for such a small administration. And we must appreciate how much work has gone into getting money out of the door quickly, properly checked, and to the right recipients in such a short space of time. And how we've calibrated this, working with unions and business representative organizations, and also with an unprecedented level of cooperation and collaboration with the Leader of the Opposition and his shadow cabinet team, using government to harness together all of the advice possible from across our economy, and deploying all of the talent in the public service to make it a reality. Exactly what you would have expected from us in this time. Of course, the £6 million that I've referred to does not include the amount of revenue that we have foregone in the past month, and which will also greatly impact the bottom line in respect of the public finances. And so, going forward, we will have to cut our clothes to fit our cloth appropriately. Remember, this level of spending on our balance sheet has no precedent in our history, not even in periods of war or the closed frontier. In those days, it was the UK spending. The UK support and sustain during the period of the closed frontier. This is the first time that we are looking to sustain so much increased expenditure on the basis of just our own revenue, paying our own way. So when CELAC meets this week, we will be looking also at what we can do to help businesses in coming months and what businesses might be able to come back already if with some precautions in place. Because that will lead to the best way for us to produce revenue in coming months, as well as looking at how we raise revenue in different ways in coming years. Because we've arrived at this crisis with the firepower to do this. But we have a duty to preserve our prosperity for future generations and ensure that we keep our finances strong for coming years as we come out of this crisis also. Finally, I just want to remind you of this. We are not out of the woods yet. It is not yet even half-time. We have not beaten the virus. It may not even be the end of the first quarter. You have to be clear about that and not put yourself in danger of contracting the virus. But I do feel we may now finally be at the end of the beginning. Happily, we are also at the end of the beginning of this information conference. And I'm now very happy to invite my good friend Stephen Linares to address you on the important work that his ministries have been undertaking in the past weeks during this pandemic. Thank you very much.
Thank you, Fabian. Good afternoon, I want to inform you about some of the works done in relation to COVID-19 pandemic in the areas of my ministerial responsibilities. I will start with housing. The Housing Department has worked tirelessly to reduce the impact of COVID-19 outbreak conditions on the Housing Department's workforce and customers. We have tried to address all probable scenarios. We have implemented all possible strategies. The aim is to continue providing our customers with a highly efficient service, whilst protecting our workforce and ensuring prioritizing of tasks and cross-training where necessary to perform all functions with limited resources. Our services are ongoing via telephone, email, and online facilities through the eGov website. The reporting office has continued to support all our tenants in adapting their priorities to ensure that the critical services such as emergency works required are delivered. More than 1,000 calls have been made to tenants, and the department is happy to report that this has been a very fruitful exercise. Step by step, instructions have been issued to all our tenants to facilitate payments through online platforms. The department is also liaising with banks to introduce new facilities for the payment of rent through direct debit. We are also assisting our tenants with opening bank accounts. The arrears team has been very diligent in continuing their operations to ensure tenants do not fall further into arrears and to assist them as much as possible should they encounter financial hardship during these times. The senior management team has liaised with our Tenants Association to provide support. We have been able to convene the relevant meetings using virtual platforms. Our weekly meetings with tenants and third parties are still ongoing via conference calling. This takes social distancing requirements into account. The department, together with the Housing Works Agency, have actively trying to curtail the spread of the COVID-19 to our senior citizens. Our efforts have concentrated mainly on our pensioners' accommodation. This is where many of the most vulnerable in our society are located. The assistance to senior citizens' accommodation include providing the daily delivery of the Gibraltar Chronicle and Panorama, the installation, maintenance of hand sanitizers, the daily removal and disposal of household refuse from outside the flats, daily cleaning of all common areas such as lifts, handrails and door handles, the delivery of food from gates within the blocks, and the restriction of visitors to the blocks. The Housing Works Agency have also given assistance to the Nightingale Hospital by providing flooring and bed dividers. We continue to take precautions by restricting visitors only for essential reasons and preferably for those to be conducted at a social distance from outside the flats. All social gatherings such as bingos and yoga have been cancelled. We are in constant communication with the elderly in these flats. My office has been calling them regularly to make sure that their needs are addressed. We also provide them with any documentation required by other public services. Anything delivered to the elderly is now sanitized. There were 2 confirmed cases of COVID-19 in our pensioner flats. Both of them are now fully recovered. The department has been closely working with the Gibraltar Health Authority to allow them to provide maximum number of beds. We have worked closely with the care agency in the relocation of tenants when required. We have worked with the Ministry of Equality too. The Housing Department would like to remind all tenants of all our estates to practice good hygiene. It is important to follow the guidelines being used daily by the Civil Contingency Office. A program of disinfection to disinfect housing estates has been coordinated and rolled out together with the Ministry of Environment. We understand that these precautionary measures being taken place is a strain on your family and friends. Tenants are eager to preserve contacts with their loved ones. But at this time, we are also increasingly concerned with their well-being. We are following expert advice regarding the matter at hand. There are others who stay in touch. There are other ways in which you can stay in touch at no risk. I know that many of you are keeping in touch by telephone, video conferencing, and through social media platforms. My staff in my office has been calling all tenants over the age of 18 in our housing estates. We want to make sure that they do not feel disconnected or isolated, and to check whether they have any needs. We would like to thank all the tenants for their patience during this very difficult time. I am also the Minister for Technical Services Department, and I can say both our highways and infrastructure sections are fully resilient in dealing with all emergencies within the essential maintenance which may arise during this time. There are also on-call crews on standby. Their role is to deal with any emergency on a 24-hour basis, 7 days a week. Our engineers and design section continue to work on essential government projects. This has included the preparation of the drive-through sampling facility at Rook, which is now fully operational. In addition, our geographical and information system coordinators is working closely with the COVID-19 civil contingency team to develop a GPS maps of Gibraltar. These maps will include the addresses of our elderly and vulnerable. They will be used to assist with the ongoing efforts to protect and help those individuals. Technical Services has also released a number of members of staff to other government departments to assist with more critical matters during these difficult times. I will now say a few words about the Sports and Leisure Authority. As you all are probably aware now, since the outbreak of the COVID-19 pandemic, the Bayside Sports Complex and the GSLA Sports Swimming Pool have been both closed. They are now part of the Civil Contingencies Plan and the wider COVID-19 strategy. The GSLA staff have been very busy in various areas assisting the civil contingencies and making sure the facilities are ready and up and running when required. Some members of the team are working from home. This ensures that the administrative tasks continue on a daily basis. Others attend their workstation to provide essential documentation when needed. Facilities are also to inspect on a daily basis and to ensure that all is well. The majority of staff complement have been redeployed to different places. 11 undertook initial training and have now spent the better part of 5 weeks in the different hospital call centres. They are working shifts, operating telephone lines and dealing with quick queries from the general public. 6 others are part of the team that is delivering goods and supplies to those over 70s and to those vulnerable members of our community. Some staff members are working from the training centre, undertaking other key roles. The GSLA staff have played an integral part in setting up the temporary hostel at the Garrison Gymnasium. This was converted in conjunction with the Europa Football Club, the Royal Gibraltar Police, and Social Service Department into a hostel, and others have also donated meals. A team led by the Sports Development Unit is on standby to assist teachers to provide children, the essential workers with a variety of set of activities. Given that the number of children attending school is relatively low, the same team has for the last few weeks provided structural physical activities to those vulnerable children in care. These activities have provided a much needed outlet from the lockdown measures for those children. The feedback has been so positive that initial discussions are already taking place about continuing these activities in some manner when some sort of normality returns. The Sports Development Team, in conjunction with the Physical Activity Association for the Mature Older Adults, known as PAMOA, and GBC, have recorded a series of exercise sessions for seniors. These can be practiced in the comfort of your home. These new sessions are already available on GBC on a daily basis. Filming of further videos will take place next week. These primarily will be aimed at seniors over 70 who might struggle with the sessions already offered. GSLA have also been involved in manning the entrances of the 4 main pensioner estates and assisting with the delivery of goods to the tenants residing in these blocks. Finally, in relation to the GSLA, the staff may also be deployed during the golden hour in order to assist our elderly. The entirety of the King's Bastion Leisure Centre has been closed since the COVID pandemic was announced. The administration staff are currently working from home. Other employees of the KGLB have been deployed to assist in the field hospital and in other COVID-related projects. The Gibraltar Youth Service, during the difficult COVID period, have continued to undertake their daily activities via the online platform Zoom, offering virtual youth work to young people in our community. All the youth activities, such as Joyful Riots Choir, the LGBTQ+ group, and the Mingle, a special project for young adults with mild learning difficulties of the ages of 18 to 30, have taken the opportunity to use the virtual platform to continue their communication with existing and prospective members. I personally met a group of young people during the virtual session recently, where those who were virtually connected shared their experience of being in lockdown. Zoom virtual youth work will continue as a way of keeping in touch with young people in their community. If you want any more information for this, it can be found in www.youth.gi. The youth service is also supporting the care agency. Laguna, Dolphin and Plata youth clubs have been opened to accommodate a resting and meeting place for all residents, care workers who support the elderly and vulnerable in our community. Various experienced youth workers have also been deployed to assist with vulnerable children and those displaying challenging behaviours. The youth service has purchased 6 computer tablets for some of our service users who do not have access to one during this crisis. This will assist them in joining the virtual youth activities on offer. It will also help them to follow any educational links provided by the Ministry, the Department of Education. In addition, these service users will benefit from the Civil Contingency Officer's tablet donation appeal. I would like to take this opportunity to thank Medicare Gib for the 24 iPads and 9 Samsung's tablets, Gib Telecom for the 20 iPad minis, an anonymous donor who gave us 2 iPads, and Gadget Station for 10 shock-proof iPad cases. I would like to take this opportunity to thanking all the members of my ministry and the relevant departments I am responsible for, whether working from their workstation or working from home for their continued support and providing an excellent service throughout, as always, especially during these difficult times. You have all worked tirelessly and under pressure, and you have acted in a positive, proactive and professional manner. For this, I am truly proud and grateful. Thank you.
So, ladies and gentlemen, there may be questions from members of the press who have sent their questions in electronically, and we will now hear from them.
Good afternoon. The first question is from GBC for the Chief Minister. Do you share the view expressed by the Chief Secretary yesterday that the time has come for the civil service to do more for less? If so, can you elaborate on what this means exactly? Is it lower remuneration for civil servants and/or keeping a similar workload in the public service with fewer people, or other?
Okay, so thank you. The running of the civil service is a matter for the Chief Secretary. I have expressed my views. I have no doubt that any changes in the public sector would come about as a result of negotiation, and I would be involved as Minister with responsibility for industrial relations. But you need to remember what I said to the public, to all of Gibraltar during the course of my Easter message. I think it's time for all of us to do more and to ask ourselves what it is that we can do more for Gibraltar and not what more we can take from Gibraltar. This is going to be generic. It's going to be across the board. When we talk about not going back to normality, we're talking about a new economic reality as well. I said that I did not believe that things would be harsh, but I thought they would be challenging, and this would affect the public sector and the private sector in the same way, I think, although, of course, I think the public sector in Gibraltar has stepped up during the course of this emergency, has demonstrated to all of its detractors just how important it is and how well it does what it does.
The next question is from YGTV, also for the Chief Minister. The UK government's Chief Medical Officer has said that social distancing will be needed in the UK until at least the end of the year to prevent fresh outbreaks of the virus. Do you think that the same will be true for Gibraltar?
Well, unfortunately, that is exactly what I've said today, that as we sit down to design an exit strategy, you start to see that all parts of the exit strategy lead you in the same direction, and that is to the continuation of what we now call in the lexicon of the year 2020, social distancing. And that is, I think, something that is going to accompany us for some considerable time. I would have thought at least until the end of the year. And in all of the models of exit that we can see developing, that is an essential and common characteristic.
The next question is from the Chronicle, also for you, Chief Minister. We understand the uncertainties and the need for caution, but as of today, based on the information you have, what is your best assessment of what this summer is going to look like in practice? Do you think beaches will be open to the public? Will there be any semblance of the outdoor social life this community is used to?
Thank you. That question asked me to look forward, and unfortunately, although we might be looking forward to going to the beach as soon as May in the usual run of play, at the moment that question is asking me to look so far forward in the way that time has become so elastic under this public health emergency that I would be crystal ball gazing a little if I was pretending to give an answer that had any semblance of certainty to it. But I will tell you what the exit strategy is leading us to, and that is to the view that going to the beach this summer will be very different to what going to the beach in the past has been. We're going to try and ensure that we bring as much normality to that as possible. It may not be probable that we will be able to do that, and that there may have to be mechanisms put in place so that people can visit the beaches and can swim, but the size of our beaches is such that it may not be possible to accommodate the numbers of people that we habitually see wanting to go to the beach with the rules of social distancing observed. I mean, I've seen, some very interesting stuff coming out of Italy and Spain with perspex areas, denominating what your areas are. I mean, if I was in a lighter mood, you would like to see Christian Santos script what it's like on Catalan Bay or Eastern Beach if you try and keep people to their 1 meter by 2 meters at the best of times in Gibraltar. Look, we're going to have to make the best of it. We're going to have to try and ensure that people can go and refresh themselves. When we get closer to July and August, if we think of those as the beach-going months rather than the wider expanse of beach-going that we might be used to, we may by then have been able to do something which is slightly different. At the moment, I want to be honest, it looks slightly bleaker than usual.
Okay, the next question is from the Olive Press, also for you, Chief Minister. Following a question from a reader, could there be more risks of infection to younger people who might have underlying conditions than very fit, just over 70s who have no issues, and could consequently this latter group be given more freedoms than just the golden hour, or is this a general rule for all?
That question, which is very carefully structured, involves a number of coulds and ifs. And we could and perhaps might be able to answer it one way, or we might decide that we could answer it in another. But given that what we want to ensure that we do is be certain, we can see that there is a line in the sand drawn by this virus which suggests that those over 70 are much more likely to die if they contract it. Our job is to protect life, and therefore we won't be taking any of the risks that the sort of conjecture that question might lead us to would result in.
The next question is also from the Olive Press for Minister Linares. Are there any plans for non-contact sports to being freed from the lockdown in the near future, or is the risk of contagion too great to risk it, and people should just go about in their own individual way?
My answer is very simple, similar to what the Chief Minister has been saying all throughout this press conference. The simple answer is no. It has to be within the roadmap that we're already doing. So I couldn't, for example, like the Chief Minister has answered about the beach, we cannot predict that. It is part and parcel of one aspect that we need to free. Of course it is. But it has to be in a very, very conditioned manner, and it all is to do with the regulations that we've actually passed today. So the simple answer is no, and obviously we're looking at it through the roadmap.
A question from the Chronicle for the Chief Minister. Both you and public health officials have cast doubt in the past on the usefulness of temperature testing at entry points and the widespread use of masks in public. Yet today you've said both might be on the cards. What has changed? How will temperature testing work in practice, for example, at the border?
So the Chronicle is absolutely right to point that out. We have said in the past that there are ways to get round temperature tests. So if somebody has a temperature, they take a Panadol, and in that way they reduce their temperature 30 minutes after they've taken it, and then they're not detected by the temperature test. In the same way, depending on what mask you use, there's a chance that 5 or 10% of what you expectorate if you cough whilst you're wearing a mask might still come through the mask. So all of these things are still, in my view, not in any way guarantees that the virus is not spread or that you catch people who are infected with the virus. So, look, my determinations are the determinations of a layperson. My training is in the law, not in medicine, and so I'm learning with everybody at the same time. The advice that we have does not change. But what I think is becoming increasingly clear is that if you haven't got a vaccine which makes humans immune, if you haven't got a medicine that means that you can cure humans, what you need to do is layer one on top of the other the many obstacles that you can put in the way of the virus. The easiest obstacle is to take humans out of the way of the virus. You create a lockdown, you stay out of the way of the virus. If you want to ease that lockdown, which is what we're trying to do in order to bring our economy back so that we have a public finance that allows us to finance the cost of healthcare, what you need to do is layer one on top of the other the many non-satisfactory hurdles that you can put in the way of the virus. So if the temperature gauge doesn't work 100% because people can dodge it, 90% of the time, it might work. If the mask only works 95% of the times, 5% of the times it won't work. If you layer 95% on top of 90%, you're starting to make some progress. You can find other things to put in place, like aggressive contact tracing, the apps, etc. You put all of those things in the way of the virus. The virus is then going to have to find its way over many hurdles before it infects somebody else. None of those things is any better today than they were 6 weeks ago. I think what's happening is that we're giving up waiting for a panacea, a silver bullet. It's not coming in time. And so we have to use all of the blunt instruments that we have, some of them not as blunt as what we've done until now, which is simply to, I was expressing it in another way to a colleague this morning, we've almost taken a medieval or Neanderthal approach to this. We've retreated into our caves whilst the dinosaur passes outside. That's little of what we want to avoid doing as we bring back our economy, as we emerge from lockdown, but we do have to put in place all of these imperfect protections to try and put hurdles in the way of the virus, even though they're still just as not 100% effective as they were when I commented about them before.
The next question is from GBC for the Chief Minister. With regards to government finances, other than costs incurred through the BEAT payments, what has been the impact of the health emergency so far on income? By how much has revenue been affected in respect of corporate and income tax, social insurance and import duty?
Okay, so it is impossible for us to give a number in that respect because corporate tax, social insurance, etc., those corporate tax is collected twice a year. And the payment for the year before, which reflects the activity of companies 18 months before, was collected in February. So you won't feel the effect of a March lockdown and an April lockdown in 2020 until the time comes for collection later on this year and next year, and ultimately in 18 months after companies close their accounts. You can do an estimate, but you can't have anywhere near the right number. With import duty, you tend to know towards the end of each month what those numbers are, but we haven't yet had a full reconciliation of what the effect on revenue is. So you cannot have anywhere near anything other than an estimate at this time, and an estimate is not something that is reliable enough to put into the public domain. But it's important that we do realize that the cost of the pandemic is not just the amount that we are spending in the Beat COVID measures, in supporting the GHA, etc. It's also the amount we are not collecting in revenue. And I think the worst months in that respect are to come. I expect very little or no tourism during 2020 in our peak tourism months, which are May to October. That will have a knock-on effect on revenue in respect of retail businesses, etc. So all of that is unfortunately to come. There may be a different type of tourism. The people of Spain are not able to fly around the world. Gibraltar might be an attractive place for people from Andalusia, for example, to do some tourism if people are able to move freely around the geography of Spain and they decide that they want to come on holiday to the south of Spain, and from the south of Spain they decide they want to come on day trips to Gibraltar. But of course there will be pandemic issues with that and how we protect ourselves from the virus coming across the frontier. So all of those economic issues are to be considered again at the end of this week by the CELAC, and I hope also by Parliament when we come back, I hope by the end of May or in June.
The next question is also for the Chief Minister from YGTV. In order to unlock, does Gibraltar need to boost its testing capacity so that everyone who has symptoms can be tested for COVID-19 and take appropriate action? Also, is it necessary to have a reliable antibody test so we can determine who has had the virus? How close are we to achieving both?
Okay, so on the first, I'll just divide that question into two. Testing, and then antibody tests. On the first, the answer is yes, we're going to do much more aggressive testing. We're already 4th or 5th in the international ranking for testing. We're going to have to do a lot more. Testing, I think, may become endemic in the context of the next 6 to 18 months. In other words, you're going to have perhaps constant testing of different cohorts of people on the front line, random testing in companies. Do you do that beyond the health service by licensing private clinics? As a test becomes recognized, all of that is to be considered, but I think you'll be seeing a lot more testing of the population, what you might call aggressive testing coming in the next round of how we start the process of exiting. The second part of the question is one I'm not qualified to answer. How close are we to the sort of test that was being described to YGTV is not something that I think anybody can really give a reliable answer to. But I do hope that we are going to be much closer to having reliable field tests which are quickly able to tell us whether somebody is infected or has been infected, has immunity, doesn't have immunity, indeed whether people are able to nurture their own immunities in a meaningful period or for a meaningful period if they've been infected by the virus is also one of the issues that science is not yet able to give us a reliable answer on. There is a third limb, which is, in my view, the most important limb, which is aggressive contact test tracing. I think that's going to be one of the things that we are going to develop the most in Gibraltar. In other words, once we identify somebody is infected and we bring about the circumstances where people tell us as quickly as they think that they may be infected that they should be tested so that we can quickly determine who has been close to them and also quickly test them and ask them all to self-isolate if they have become infected, and in that way close down any future clusters of the infection when it comes to Gibraltar. Aggressive contact testing and voluntary, immediate notification that you might have the virus are what we need to bring about, I think, while science continues to fail to give us an answer or a cure.
The next question is from the Panorama. Panorama says that they are receiving numerous questions from readers. Here is one of them. Can we look forward to government offices being open for normal hours like other countries, 9 a.m. till 5 p.m.? Here in Gib, offices open too early for normal working people to attend.
Well, I think that question is one which is unrelated to the pandemic. But I think that what we need to do is to move away from the concept of offices having to be open. And what the pandemic has shown us is that we can provide public services remotely more effectively in a way that is not just more efficient for the public service, but also more efficient for the general public. What the government has been told, what we are being told by citizens, people writing into us, is that they are enjoying the new mechanisms of access to the government and to the public service, and that they want more of the digital access that we're offering and less of the old style, government counter, which requires people to make their way out of wherever it is that they may be in business or carrying out their daily life, having to displace themselves to a government office at New Harbours or elsewhere in town.
Also from the Panorama, how many over 70s have been tested positive for coronavirus?
So I don't have that statistic at the moment, but I can tell you that a number have. Indeed, we had a very high-profile case of a lady who recovered and who gave us all hope in the way that she told us how she'd got through the virus, but I don't have to hand the statistic of how many of those of the 133 who have tested positive were over 70. The lower that number, the more effective our rules have been.
And the last question is from GBC for Minister Linares. Why is the Housing Department only focusing on pensioner accommodation buildings when numerous over 70s also live on their own in other estates? Do you agree that they are also deserving of newspapers, hand sanitizers, etc., in the same way as those in pensioner buildings are?
Well, I don't agree that we have only been focusing on the people who live in the pensioner flats. It is precisely why my office, and I have given instructions to my office, to phone the 1,500 pensioners who live in other places in our estates and phoning them personally through a personal contact and asking them what their needs are. And that means we've been asking them, do you need anything? Do you need a chronicle? Do you want somebody to deliver to you personally anything? And we have taken the trouble, it's the work that we think that they also deserve. Everybody deserves the same services from government. And I can assure you that we have been phoning, like I said, making sure, like I said in my speech, so that they don't feel disconnected, they don't feel isolated. We have a team that as soon as anybody has any needs, We go directly because we know where they live and if they need anything. And they also, some of them have even called back saying that they need something. Immediately we assist them. So I don't agree that we have only been focusing on the pensioner flat. The issue is that with the pensioner flats, it's easier to do anything with them because they live all in the same place. But we are aware of the 1,000, like I said, 1,500 who are elsewhere, and we are completely monitoring their progress or if they need anything.
I hope you also offered them the panorama.
Yes, I will do.
Although it's
The
Chronicle and
the
Panorama.
yes.
It's Chronicle and Panorama who
Both.
are distributing in
Yes.
those estates. It's not the government. And I want to thank both the Chronicle and Panorama for having had that idea that they wanted to distribute newspapers at this time in those estates. I think it's been a magnificent gesture by both the editors, but it would be unfair for us to take the credit for it or indeed to take the blame for not distributing it more widely.
We are offering it to everyone, in fact, including the
Ladies
Panorama.
and gentlemen, thank you very much indeed for joining us today. Remember, the lockdown has been renewed. The virus is out there. Stay home, stay safe, follow the law, follow the advice. Thank you very much for listening. And tomorrow there will be another information conference. Thank you.